my surgical loop that I got from Zeiss. It has been delivered all the way from Bangalore. So this is like a really big box, and this cost me a lot of money. Anyway, let's open this up using this surgical blade and let's get to it. So as plastic surgeons, we do quite a lot of microsurgery, that is surgery under magnification, for which we require either an actual microscope or these surgical loupes. Okay, so this is how we get the package. So I expected a lot of those foams over here, but there wasn't much. And this is the case. Here it is. You can see again, it's a very big box that they gave me. And I'll put this aside. So this is the Zeiss iMag medical loupes. We can order different magnifications, different working distance, and different styles of loupes. So one is like with the spectacle sort of frame with a flip up design. This is the headband. I don't know what they call it. It's like I call it the headband. Headband kind of, it's like a helmet sort of thing in which this thing is attached. So I'll use my own actual spectacles, and then on top of this I'll use the loupe. So there are different type of loupes. The recent ones that are available these days is the through the lens loupes. Those are called TTL loupes. That is, you will buy a loupe with a spectacle, and the lens is through the lens of this, so it's attached over here. Those are the through the lens styles. And then we have flip up styles. So flip up styles can be with a spectacle frame, and then the loupe is like in front. So this is like a headband, and then the loupe is in front. So this is the Zeiss iMag medical loupe, and let's open it up. So yeah, I was talking about the magnification and all. I ordered 4x magnification with a working distance of 450 millimeters. So that is 45 centimeter. So I have to be sitting like this while operating, and from the side of operation to the end of the distal end of the loupe, it has to be like 45 centimeter for the best focus. Now let's open this up. So here you have to take my choice. So we can have 4x with 300 working distance, 300 millimeters, and 3.6x with 350 millimeters, 3.5 magnification with 400 millimeters, 3.3, 450, 3.2, 500, 5x 300, 4.5x 350, 4.3x 400, 4x 450, and 4x 500. So mine is 4x 450 millimeters working distance, and the field of vision that I'm going to get is 86 millimeters. So the model is iMag Pro S. So we've got a really nice bag, but there's no handle for carrying it. That's a shame. I was expecting that there'll be like a handle or something with which I will be able to carry this. Otherwise, it's going to be really difficult to carry this around. One reason why I was skeptical about getting this design is carrying this big bag everywhere I go. Anyway, that was a choice, that was a sacrifice I had to make, because the one with the spectacle frame comes in a smaller package, which is very easy to put into a backpack and carry around. But still, I went for this for the comfort of having the weight of the loupe on my head instead of on the spectacle. And with this, I can change my spectacle glasses, buy a new one, and I don't have to change my glass. Like if I take the one with the spectacle, the loupe with the spectacle, then I have to take my normal specs off and put that on and work with that. So sometimes, I face this problem that if I have two spectacles with the same power and same thing, whenever I remove the one that I'm using normally and put the other one, sometimes I feel like a headache or feel dizzy. So it's best for me to use the one that I use all the time at all times, so that I don't feel that headache or dizziness. So I can put this on, and let's take a look. Oh, so they've provided those guards for the loupe, and there's a preparation of I don't know what this is, something like preparation of the processable products asepsis. And here's like a manual, I think, how to care and maintain replacing the optical system, configuration, and blah 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 in many different languages. So it's a very thick book. We've got a cleaning cloth that is 40% polyester, 30% nylon, and we've got key for, I think, loosening things up and fixing, tightening them. And these are washable stuff which are on the inside of these things, because it's going to get sweaty and dirty, so we can remove this, replace it with those, and these are washable. So it's time to open this up. All right. Okay. So this is it. My loupe. My surgical loupe. Let me loosen things up over here. Okay, so we press this button and we tighten it, and we press it, loosen it up. We rotate here for loosening up, we rotate this way for tightening it. So okay, let me check it out. We place it here, let me tighten it. Tighten it up from behind. Okay, I've got this on. Now I'm going to check out these fonts over here. Okay, for that. Okay, this is the lock. So I move this. Okay, all right. Okay, let me close one eye. It's like really difficult to set this up. I haven't got the focus yet. Let me try again. Too far. Okay. It's supposed to be closer to my spectacles like this. Now I can see things better. Okay, so I've got the focus on, and yeah, so things are quite, I can see from here to here. So is this, I can see from here to here. It's a bit, okay, so it's not focus here, it's not in focus here. Here, it's in focus here. So let's say I'm walking over here. So I think, yeah, it is as expected. It's, I think, 45 centimeters in distance, like I expected. So yeah, this is how it looks. And about what I see over here, I cannot show that to you, of course. So I'm quite happy with this purchase, and it's good. There was a button over here to make it go higher and lower. Okay, I have to loosen this up so that this thing goes lower, and yeah, that's better. I'll imagine that I'm walking over here. Let me look at something very small. Can I look at my own fingerprints? So my distal phalanx looks pretty long like this. So I've got binocular vision. Things are in focus. Wow. That's very clear. So this Loupe shows over here that it is a 4x magnification with a 450 millimeters working distance, and it says Zeiss over here. So this is for loosening, and so that it makes it easier to manipulate this, and when I push it this way it becomes tight. And this is a knob for putting this whole loop area up and down. This is the headband. It's quite high quality, and we've got replaceable pads in here, over here, here, and here. And yeah, we got some case over here which I'll open up. Let's open this up. And so I've got these two protective stuff for the lens, and let's put it on. Okay, that went all the way through. That's how it goes in. For the other side, it goes in like that, and now it's in place. So now when I keep it on the table or something, I guess that's going to be a little bit protective. So let me put it on again and see if everything is in focus or it's been moved away. Okay. Yeah, it's quite alright. Things are in place. I think I'll be able to do surgeries better with this now. So this is my Loupe, and I'm going to be using this quite a lot, for many years actually. So it's a good purchase. How do I look? I look cool. And when I want to flip it up, when I want to talk to people, I can just flip it up like this and yeah, talk to you, talk to patients, relatives, talk to other doctors. And when I'm done, when I want to start operating again, I can just flip this down. And yeah. Whoa. Things are very clear. So that's my Zeiss Loupe.